A cold and the flu are both respiratory illnesses, but they are caused by different viruses and have distinct symptoms and impacts. Understanding these differences can help in managing each condition more effectively. The common cold is primarily caused by rhinoviruses and tends to have milder symptoms. These include a runny or stuffy nose, sneezing, sore throat, and a mild cough. Fever is rare in adults with a cold but can occur in children. Generally, cold symptoms develop gradually and are less severe. In contrast, the flu is caused by influenza viruses and typically presents more intense symptoms. These include a high fever, severe body aches, fatigue, headache, and a dry cough. The onset of flu symptoms is usually abrupt, and the illness can lead to more serious complications such as pneumonia, especially in vulnerable populations like the elderly, young children, and individuals with chronic health conditions. Both cold and flu viruses are transmitted similarly, primarily through respiratory droplets when an infected person coughs or sneezes. However, the flu is more contagious and can spread quickly, often leading to seasonal epidemics. The cold is less likely to cause widespread outbreaks. Treatment for a cold focuses on relieving symptoms since antibiotics are ineffective against viruses. Over-the-counter medications, rest, and fluids are commonly recommended. The flu, on the other hand, may be treated with antiviral drugs if caught early, which can shorten the duration and severity of symptoms. Vaccination is also a key preventive measure for the flu, significantly reducing the risk of infection. Prevention strategies for both illnesses include frequent hand washing, avoiding close contact with sick individuals, and maintaining good overall health. For the flu, getting an annual flu shot is highly recommended. While both the cold and the flu share some symptoms, the severity, onset, and potential complications differ significantly. Understanding these differences can help in choosing the appropriate treatment and preventive measures. 2. What is the difference between type 1 and type 2 diabetes? ChatGPT. Type 1 and type 2 diabetes are chronic conditions that affect how the body regulates blood sugar, glucose, but they have distinct causes, characteristics, and management approaches. Type 1 diabetes is an autoimmune condition where the immune system attacks and destroys insulin-producing beta cells in the pancreas. This leads to little or no insulin production, requiring individuals to take insulin daily to manage their blood sugar levels. Type 1 diabetes often develops in childhood or adolescence but can occur at any age. Its exact cause is unknown, though genetics and environmental factors are believed to play a role. Type 2 diabetes is a metabolic disorder characterized by insulin resistance, where the body's cells do not respond effectively to insulin, and the pancreas cannot produce enough insulin to compensate. It is more common in adults but is increasingly seen in younger populations due to rising obesity rates. Type 2 diabetes is largely influenced by lifestyle factors such as diet, physical activity, and weight, along with genetic predisposition. Symptoms of both types of diabetes include increased thirst, frequent urination, unexplained weight loss, fatigue, blurred vision, and slow healing sores. However, type 1 symptoms tend to develop quickly over a few weeks, whereas type 2 symptoms may develop gradually and be less noticeable. Management of type 1 diabetes primarily involves insulin therapy, which can be delivered through injections or an insulin pump. Monitoring blood sugar levels, maintaining a healthy diet, and regular physical activity are also crucial. For type 2 diabetes, lifestyle changes such as weight loss, a balanced diet, and regular exercise are often the first line of treatment. Medications, including oral drugs and sometimes insulin, may be necessary to help control blood sugar levels. While both types of diabetes can lead to serious health complications if not managed properly, type 2 diabetes complications are often related to long-term damage caused by prolonged high blood sugar levels, such as cardiovascular disease, nerve damage, kidney damage, and eye problems. Type 1 diabetes also carries these risks but is additionally associated with complications from fluctuating blood sugar levels, including diabetic ketoacidosis, DKA. Prevention strategies differ as well. There is currently no known way to prevent type 1 diabetes. In contrast, type 2 diabetes can often be prevented or delayed through lifestyle modifications like maintaining a healthy weight, eating a balanced diet, and staying physically active. Understanding the differences between type 1 and type 2 diabetes is crucial for effective management and treatment, improving quality of life, and reducing the risk of complications associated with each condition.